Hi again, everyone. In this video, we will be talking about time management strategies for MCQs in medical exams. First of all, you need to know your time per question. You should have calculated the average time per question way before the day of the exam. For example, if you have 120 questions to be answered in 180 minutes, that will mean 1.5 minutes per question. So, this you need to use as your internal pacing guide. Use the 3 pass strategy. This is a proven method for MCQ exams. First pass, quick wins. In the first go, answer questions you immediately know. Spend less than 30 to 45 seconds per question and flag and skip any difficult or long questions. The goal here is to secure easy marks quickly. The second pass is for moderate questions. Return to flagged questions requiring thinking or calculation. Spend your allocated full time per question. The goal here is to capture the majority of the remaining marks. The third pass, or the difficult or guessing stage. Here we focus on long stems, uncertain answers, questions needing elimination, and we make the best educated guesses. The goal is to avoid leaving blanks. Having said that, remember that some exams carry negative marks, and you may need to rethink this third step. Read the question stem first. Instead of reading all options first, read the last line of the question to know what is being asked. Is it a diagnosis, next step, investigation, or management? This prevents wasting time on irrelevant details. Avoid overthinking. This is a common issue in medical exams. What are the signs to say that you're overthinking? Changing answers repeatedly, spending more than 2 to 3 minutes on a question. The rule: if you're unsure after reasonable thinking, mark and move on. Use strategic guessing. MCQs are probability games. Eliminate clearly wrong answers, options inconsistent with guidelines, or extreme or unrelated choices. This increases your odds from 1 out of 5 to 1 out of 2 or 1 out of 3 chance. Watch the clock at key checkpoints. Maintain good pacing. When 25% of the exam time has lapsed, you need to have completed at least 40% of the questions. At 50% exam time, at least 70% questions should be completed, and 75% of time, 90% of questions done. If you are behind, speed up and use elimination faster. Don't get stuck on long clinical vignettes. Use a rapid approach. Look at the question line and then scan for age, key symptoms, vital signs, red flags. Make sure to ignore distractors. Mark and move strategy. Always flag uncertain questions and continue the exam flow. Spending too long on one question will cost multiple marks later. Save time for review. Reserve at least 10 to 15 minutes at the end to revisit flagged questions, check misreads, correct obvious mistakes. Avoid changing answers unless you find clear evidence that you were wrong. Practice under timed conditions. This is the most effective strategy. Simulate real exam conditions. Use question banks with timers. Train your brain to work at exam speed. The key formula: do the easy questions first. Have controlled pacing together with strategic skipping. This will enable you to gain the maximum score in MCQ exams. Stay tuned in as more tips on exam preparation are coming up in our next video. Don't forget to like, share, and subscribe to our channel. Also, do drop in your thoughts in the comments section. See you soon.